Hello, this is Dr. Sukalyan Purkayastha, and I'm a neurointerventionist, and today I'll be talking about the endovascular treatment of brain arteriovenous malformation. So this is a disease of the brain where the brain arteries and the veins are involved, and there is a tangle of abnormal blood vessels in the brain which is thought to be congenital, but it can be developmental also. And the problem it creates that it can bleed inside the brain and it can cause stroke, which is one of the very bad situation which can arise from this sort of disease, or it can cause very slow and progressive neurological deficit, or sometimes the patient can present with seizures. So these are the ways the brain arteriovenous malformation presents. And now let me talk about how the brain AVM looks like. So you can see the slide where you can see that there is a tangled, enlarged, abnormal arteries and the veins, and the area where they are conglomerating, where they form these tangles, we call it nidus, and these are supplied by the abnormal arteries and drained by an abnormally enlarged vein. So this is how an AVM looks like, and if you see in the slide that one of the tiny AVM, so this is a cartoon, a small AVM on the surface of the brain. It can be situated anywhere in the deeper areas of the brain as well. So how can we know that there is a brain? Well, it's very difficult to know without doing an imaging, and in the present time I would say magnetic resonance imaging is one of the best technique with which we can detect this very tiny or even the tiniest of aneurysm AVMs in the brain. And this is an axial T2 MRI of the brain, and where you can see that abnormal arteries, and this is a typical appearance of the arteriovenous malformation. Now, what is the natural history? 64, or I would say around 60 to 70% of the patient clinically present at the age of 40. How do they present? They can have a seizure or they can present with hemorrhage. Around 50% present secondary to hemorrhage, so which is very bad message. And there is around 30% risk of death from that bleeding, depending on the size of the bleeding, until and unless this is immediately treated by open surgical means, by taking out the hematoma if it's a big bleed. But if there is a small bleed, you don't need to open the skull, and you can treat those patients with an endovascular means. 20 to 30% of the patients may develop neurological deficit. Now, this is one example. I would say the patient is a young patient. You can see that this is a CT scan where in the right side of the brain you can see the white thing which is the bleed. Okay, so when the patient which is non-hypertensive, they come out with this sort of bleed, the most important thing which comes to our mind is an arteriovenous malformation or any vascular malformation of the brain. Now this is the CT scan, and then this is the CT angiogram and the contrast CT. You can see that tangle of abnormal blood vessels, which is the AVM. And what is the next step? We do a test called DSA, digital subtraction angiogram, which is the gold standard investigations for detect and the treatment planning for AVMs. Now this is again the same patient. You can see the DSA pictures of the brain AVM, so you can well understand and you can get an idea how the AVM looks like in digital subtraction angiogram. Now I'll just come to how we treat that by endovascular means. Well, before telling by the endovascular, I should also mention that there are three ways of treating the brain AVMs. One is obviously by embolization, which is called the endovascular surgery or endovascular interventions, where you don't need to open the skull. We again go through a tiny puncture in the groin artery and reach the brain, and we block by the process called embolization. The second is open neurosurgical technique, Okay. So in open neurosurgical technique, we prefer when there is a large amount of bleed which has happened already from these AV malformations, and you need to take out the bleed or the clot or the hematoma for reducing the pressure inside the brain. So that's when you require, specifically you require the open surgical technique. And the third thing or the third modality is the radiation. So in some cases we also prefer radiation where it is quite deep seated, such as in the brain stem or in the deep basal ganglia of the brain, where the endovascular means may not be appropriate. So we treat those patients sometimes by radiation as well. But when the patient comes with bleed, usually we try to we prefer by embolization or by open surgery. But embolization is the first choice because here you don't need to open the skull and you can treat without any incision or without any risk of open neurosurgical technique. So here in this slide you can see that there is a tiny catheter which has reached the AVM site, and we have blocked the whole of AVM with a special material called onyx, or sometimes we also use some other devices like NBCA or glue. And in this slide you can see that the whole of the AVM has completely gone, and the angiogram or the DSA looks like a complete normal. And this is the post treatment CT scan. All the patients, we take a CT scan, and here we can rule out any other problems which can arise related to the treatment. So in conclusion, embolization nowadays can be curative up to 80% of the patients because of the newer materials available and the newer embolic materials and the newer devices like microcatheters, microwears, which has made our life very easy, simple, and also for the patients. And if there is a large clot involved, obviously we have to open the skull and take the clot out. Sometimes after embolization, if there is any residual small part of the AVM is left, we sometimes send it for radiosurgery for finishing, or we can go for re-embolization to treat the whole thing. Sometimes it can also happen. So I would say embolization, endovascular treatment of brain AVM is a very elegant way of treating this disease of the brain, and this is quite patient friendly, and they can the patient can stay in a very can go home in a very small time, and the trauma, the mental and the physical trauma for the patient is extremely less. So this is a small educational video which for the general population, and you must know this, that how a complex disease like brain AVM can be treated with such an elegant technique without even opening the skull also. Thank you.